My pronouns are she and her, and I'm presenting today mostly on the development of these resources, but we'll touch on what the resources are as well. Rowan, who is the other half of my team and works on this project as a consultant, was unfortunately unable to join us today, but their experience as a midwife and an IBCLC has been incredibly invaluable to the work we have done and continue to do. The work has been done with Transcare BC as part of a larger Health Canada Sexual and Reproductive Health Grant project. And the beautiful illustrations throughout this presentation were created by Carla Monterosa, and we commissioned them for this project. So first, I wanted to, as a second-generation Dutch settler living on the traditional and unceded territory of the Musqueam people in what is colonially known as Vancouver, British Columbia, I want to recognize, celebrate, and honor Two-Spirit and gender-diverse Indigenous people, their families, and their communities' histories of resilience and brilliance. Our main office for Transcare BC is situated on the traditional and unceded lands of the Ho'okwemelen and Squamish speaking peoples, the Musqueam, Squamish, and Tsleil-Waututh nations. Additionally, I want to acknowledge that although I do refer to evidence or evidence-based resources, as we are all familiar with it within our systems throughout the presentation, I want to also recognize that this language does privilege a Eurocentric understanding of what evidence is, and this can erase or minimize other ways of knowing, such as Indigenous ways of knowing, that have supported healthy and holistic infant feeding practices in people of all genders since time immemorial. So the overarching goal of this project was and is to empower TTNB people to make infant feeding decisions that center their values, goals, personal beliefs, relevant medical or surgical history, and their available support systems. We're going to briefly talk about all of these things today. So I'm going to give you a brief overview of what Transcare BC is and what we do, how we approach knowledge gathering, how we approach resource design, how we did our review process, and what resources we have available that are community or client facing, and what resources we have available for clinicians. So Transcare BC is a provincial organization, and we provide support to primary care providers, clinicians, and trans communities across BC. We hold some surgical wait lists, but for the most part, we don't provide direct clinical care and are mostly focused on that education and support. This project, as I mentioned, is being funded through an ongoing Health Canada Sexual and Reproductive Health Grant. We were awarded this grant in 2022 and have since gotten an extension to the end of March 2027. At the beginning of the grant, there were some discussions with clinicians and community members, which identified a clear need for TTNB-specific infant feeding content that reflected the diverse needs of TTNB parents who are growing their families through pregnancy, adoption, surrogacy, as well as blended and chosen families. So we wanted the resources to reflect all of the different needs and all of the different feeding options. In response to these identified needs, Transcare BC brought together a group of subject matter experts to brainstorm what topics were needed to be addressed by this project. This is when I came on board as a master's student in May 2023. I did not come on board as a subject matter expert. I just was available and curious, and I've been learning so much since then. And so from there, we had these amazing brainstorming meetings, and then we moved into literature reviews, environmental scans, and into focused interviews. And all of this knowledge gathering took place in the second half of 2023. And what I'm talking about on this slide is going to touch on what was available then. There have been some really significant changes in some areas of the language that people are using on their websites and creating slightly more inclusive infant feeding resources. So there is, in general, compared to other infant feeding academic literature, the literature that focuses on TTNB people and their infant feeding experiences is smaller, but the literature review findings supported what we were hearing from community members and subject matter experts. So it was a bit of an informal triangulation that everybody was kind of saying the same thing. We heard that TTNB parents are often excluded or not represented in infant feeding spaces, including in healthcare offices, parent groups, and published resources. Parents frequently experience microaggressions in these spaces, such as being misgendered, and may isolate or distance themselves from these spaces as a form of self-protection. Our environmental scan, done after the literature reviews, looked at gray literature, so websites, available handouts, PDFs, anything we could get our hands on, in an attempt to find inclusive infant feeding resources. This search, surprisingly, at the time, demonstrated that while there were many great evidence-based infant feeding resources available, most of them used gendered language and assumed that people who are feeding an infant are cisgender women, including some surprising resources such as like bottle feeding handouts, which we didn't expect to see. Additionally, these resources often didn't focus on the diverse infant feeding needs of TTNB families, such as co-feeding, lactation induction, and lactation suppression. And as a result, clinicians who want to support TTNB families with infant feeding may find it difficult to provide evidence-based care due to a lack of resources and a difficulty finding any sort of educational material to support knowledge growth. And finally, for our interviews, we had a team member who is trans and has been pregnant and fed an infant do focus interviews with TTNB families to learn more about how they experienced infant feeding and what resources or supports they accessed or needed but were unable to access. So based on these findings from our knowledge gathering sessions and definitely some trial and error of how we were approaching things, we developed a list of kind of principles or ideas that were foundational to this project and worked to inform a cohesive approach to both the clinician and community-facing resources. So the first of these was we knew we wanted to provide inclusive but also accessible information to support informed decision-making, which ties directly back to the goal of the project to empower informed decision-making that considers individual factors. We paid careful attention throughout to what language we used and how we applied that language in the creation and revision of these resources. We aimed to create an inclusive tone that avoided judgment and created space for everyone, regardless of their parenting journey or their infant feeding decisions. So we didn't assume that everybody who was feeding a baby only had, say, one partner. We didn't assume that everybody who was feeding a baby had any partners or that they had been pregnant or that a partner had been pregnant. So we tried to leave a lot of open space for flexible family arrangements and parenting arrangements. We believe that parents are the experts on how they feed their infants and wanted to provide them with as much information as possible to make these decisions. And so in our community-facing resources, to ensure that these resources were inclusive but also had as much information as possible, we checked any external resources we linked to make sure they use gender-inclusive language to avoid causing any harm. And where these resources were not available, we actually omitted topics rather than redirecting to potentially harmful resources. Where we could, we recreated those resources or adapted them, but in some cases, we just couldn't figure out a way to include them. But as external resources have become more inclusive, we've gone back and edited content to make sure those resources are available for community members. And you will hear me touch on this frequently, but to ensure information is accessible, we have linked between resources and made sure all these resources are freely accessible online by any audience from any location. So they're not linked to only people in BC can see them or only clinicians can see the clinician resources. Everybody can see everything. Secondly, we wanted to create resources that can be used regardless of whether someone has access to a supportive healthcare provider, which is tied to ensuring the information is accessible. We created these resources to support TTNB people to navigate infant feeding and ideally hope that they will be used in partnership with clinician support. But in the current climate, in certain locations, it's really tricky to find a supportive clinician. And so we have balanced this by considering, particularly in the client or community-facing resources, when to recommend contacting a provider and when self-management is likely safe and what signs people should be looking out for, informed by current research, clinical guidelines, and clinical experts. We also chose not to emphasize human milk as the best option for all families. We heard from community members that enthusiasm and emphasis on human milk can be harmful and contribute to feelings of guilt and shame when they're unable to make enough milk to feed their baby. And additionally, for many TTNB parents, surgical history and gender dysphoria can limit their options to produce a significant milk supply or body feed at all while still maintaining their mental wellness. So our process involved finding a balance with ensuring we provided as much information about how to body feed or feed an infant from the body, and the benefits of providing human milk, but also providing other methods without prioritization or valuing any of these options. We chose bright and joyful colors for resources and integrated these beautiful illustrations that we've heard multiple times that people feel quite represented by. So that always brings us joy when we hear that. And we are aiming to support clinicians who are new to gender affirming care or new to infant feeding care or new to both. So we knew we might be catching from both audiences and didn't want to make people feel like they didn't have the information they needed. In these resources, we use body feeding as a gender neutral term for feeding an infant milk from the body, with or without supplemental feeding equipment. And it is a term that has come from community, and we felt like it was a really good fit for these resources. We also, however, recognize that it's not the only inclusive term you can use, and in some cases, options like chest feeding or additive language such as chest or breastfeeding is going to be a better fit. And language is always context specific and should always be individualized based on the client or patient you're working with. To briefly highlight the review process. So as I mentioned, we did go through multiple revisions and reviews, including how they looked, what topics we covered, how we approached certain topics. And one of the unexpected benefits of this project was getting to work quite closely with a few provincial partners. And that's allowed for relationship building and allowed for us to have input into their resources and them to have continued input into our resources, which has been really great in the few years since we've really started releasing these resources. So now I'm going to briefly touch on all the types of resources. You can find the URLs and QR codes here that will direct you to the resources, but the colorful resources are community-facing ones. They're PDFs for clients or patients, whatever language you use there, that cover important pregnancy and infant feeding topics that were identified by both community members and the literature review. They integrate available evidence, community-based knowledge, and provider expertise. And the community-facing resources are evidence-based. They have citations, but they are a little bit more of a summary and less of the specific numbers related to, say, the research. As far as I can recall, all of the PDFs are actually available in English and French, although the landing pages are still currently just in English. And some of the topics include deciding how to feed your baby, what to expect during and after pregnancy, co-feeding, and how to use supplemental feeding systems. For the clinician-facing resources, we have two. The first one that we're quite excited about is our clinical handbook. It's an online resource for clinicians. It's optimized for use on all devices. Again, it's freely available, easy to access, and it integrates all the same available evidence, community-based knowledge, and provider expertise, but it adds an extra depth of what exactly the evidence says or provides some more statistical information, but is still aiming to be accessible for any audience. It is many of the topics, not all, but most of them are aligned with community-facing resources to provide that extra depth of information and to give providers the knowledge they need to support their clients. And it's not in a PDF form because it's been designed to live on our website and be easily updated so that you don't end up in a situation where you have a PDF saved to a folder somewhere on your computer that's now outdated and doesn't reflect current evidence. The topics here include a fairly large gender-affirming approach to infant feeding document, history taking for infant feeding that looks at both TTNB specific factors and other general infant feeding factors, and then body feeding and testosterone and body feeding after chest surgery, some of which are also available as client-facing resources. And finally, our online course provides an introduction to a gender-affirming approach to infant feeding, and again is designed for both people new to gender-affirming care, people new to supporting infant feeding, because we were recognizing that more primary care providers might be doing this work, as we have, I'm pretty sure across most of Canada, at least, difficulty finding perinatal care providers right in those early weeks. So we've used a roadmap framework to detail points in a care journey where an infant feeding conversation can be had. So like when to introduce the conversation, coming back to the conversation, creating a plan that may or may not include you, but maybe includes an IBCLC or a midwife or a home nurse, and trying to open up the opportunities for people who feel like they can provide or at least start those conversations. And while we do link as much as possible to our clinical resources and community-facing resources throughout the course and in the case studies there, we don't have them living only in the course. So again, you don't end up with a folder of PDFs that you've saved somewhere, but you just cannot find when you need them. And it is available for free on the Transcare BC learning system, although you do need a login for that one. Anybody can log in.